So we're going to start with, or I'm going to start by introducing Sarah Lloyd, who's the Theme Public Advisor with the ARC, Surrey, Sussex, and has done a lot of work supporting us with her own experience, but also runs her own community interest group in Folkestone, which offers a really lovely creative community space where social activism can take place through any means, but including obviously art and research. Sarah's helped to create today, so thank you very much, Sarah. And you're going to give us an overview now of what to expect in the next 2 hours. So over to you, Sarah.
Thanks, Vanessa, and hello. Yeah, so thank you for the lovely introduction. When we first decided, when we were first deciding about the format of today, we spoke a lot about confidence in people and people feeling that they have a lack of artistic ability. So I thought it was really nice to start with these Collins Dictionary definition of art versus the definition of creativity, because the way that I frame a lot of my work that I do is that it's creative work. The term art can be quite daunting, and I like to think of creativity as creative thinking and problem solving, which is a lot easier for people within research to kind of grasp an understanding of. So I've got here the definition of art. So art is the activity or educational subject that consists of creating paintings, sculptures, and other pictures or objects for people to look at and admire or think deeply about. But the definition of creativity is the ability to transcend traditional ideas, rules, patterns, relationships, or the like, and to create meaningful new ideas, forms, methods, interpretations, etc. Originality, progressiveness, or imagination. So I just wanted to highlight those differences. That is by no means diminishing the practice of art. I still would call myself an artist and a creative researcher. But I hope that gives you kind of an overview of what we're looking at today. It's a variety of creative methodologies. It is not just sort of painting. But as a public advisor, I very much find words very difficult. So the act of offering something more creative to be able to express myself is very important. And that is what I think is a summary of today's session. So thank you, Vanessa. And that slide can come down. Thank you.
Lovely. Thanks, Sarah. That sort of leads really nicely into our first session, which is around why would you use a creative approach? What are the benefits and why consider that? And in this aspect, in this talk, we've got Sarah, Azimma, Raz and Nikki, who are all members of a special interest group on creative health in dementia research. So they're going to share with us why consider using a creative approach in patient and public involvement. And there'll be time for questions at the end, but I'm going to hand over to you, Raza, now. Thank you.
Thank you, Vanessa. Can you just confirm if the slides are full screen?
They are now, yep.
They're on the wrong screen for me, but I'll manage. Right. Hi, everyone. It's nice to see some familiar faces, or in some cases, names. It's really nice to see people I've not come across yet. It's not my first ARC symposium, but I think this one might be the best attended one. So yeah, it just shows how much people care about creative approaches in PPI and perhaps research more broadly. As Vanessa has already said, and I really hope the slides are moving because they're not moving on the right screen for me, but you're kind of getting a buy one, get three for free. So I'm repping ARC KSS here today, but there's 3 colleagues with me, all of whom will introduce themselves as we start our different slots. But we are part of a DEMCOM community, so a group of dementia researchers. And within this fellowship track that we're part of, we've got different special interest groups that different one of us join. So we're joining on behalf of the Creative Health Special Interest Group. There is, if I've counted correctly, but Sarah, do correct me, I think 18 of us, but we kind of felt that hearing from 18 people in 20 minutes might be overkill and discombobulating. And I've done that enough with really garish slides, but I hope you'll indulge me. So yeah, you get 4 of us, you've got 4 different experiences, examples, and a presentation on why bother. What are the benefits of using creative approaches in PPI? And I do realize that to a degree we are preaching to the converted because you did come to this session. But perhaps there'll be a couple of things that make you think or bring in yet another perspective, strengthening the fact that creative approaches are absolutely something we should be trying. So I'm just starting out with a broad overview or like a little bit of a flavor of what's to come next. And as part of the special interest group, a couple of months ago, we ran a workshop at the Dementia Futures Conference, very expertly led by our chief, Sarah. And there we brought together people living with dementia or affected by dementia, creative practitioners and researchers to talk about kind of the same topic. It was broader than PPI specifically, but we asked what the benefits would be, among other questions. So you're getting the very first flavor of what those whys were from this workshop. So partly, and I'm sure it will come as no surprise to anyone, it's about how we share power. It's about equalizing. I may come to this with, or I may come to public involvement and engagement with the very best intentions and a genuine belief that I do not have the answers. People with lived experience do. But that's not necessarily how it's going to play out in the room, especially not at the beginning. I may come with a role and status as someone who's leading the research. If not, then I come with a doctor to my name or, status of working at a university. And I know that sometimes, despite of what I try to work with people on equal grounds, someone might be doubtful expressing their opinion. They may be particularly doubtful to disagree with me because we aren't on equal footing. Not to mention that sometimes I hold the purse strings of, paying people for their participation or for their involvement. What creativity does, particularly with me in this case, because I consider myself creative, but I am not artistic in the slightest. I could not draw to save my life. And usually if we're engaging in something creative together, then I can guarantee that I'll be either the slowest or whatever we're creating together will look perhaps a little bit sadder when I make it. And that is such a nice reminder then in a group around different expertise and different set of skills and how lived experience matters just as much. And that's just one quick example, but I'm sure it resonates with many of you that that's how equalizing works. Creativity, not necessarily through artistic production of something, but engaging in creativity just really makes it a more level playing field. It's also a way to communicate. What I said already hints at that, that interpersonal communication, how we engage despite different roles or different experiences that we have or inhabit. Despite that, creativity can facilitate this, can facilitate how we talk to each other, but it can also facilitate how we talk to others. And Sarah will be giving a great example about public involvement and engagement in then gamifying how you talk about research to the public. And lastly, it's a pathway to impact. And I mean here more than dissemination or making messages land. I'm talking something called the failure bonus that you may be familiar with. It comes from business studies, I think, and it's about rewarding people's failures, encouraging them, not just successes. And there's a whole ton of research saying that, and again, it will surprise absolutely no one, but that we learn through our failure. Failure leads to success later on. But in research, we tend to have predefined ways of going about things, like this is how an interview should be conducted. This is what a good survey question looks like. This is how to operationalize, or, any of those things. Creativity helps you break out of those bounds and do things differently. Does it always land? No, sometimes it falls flat on its face. But when that happens, usually there's many more benefits ahead from all the learning that we've done when we fail. There's going to be much more of people putting it much better than I have. But I want to hand you over to Sarah, who's got some really cool stuff to tell you about animals.
Just to segue a little bit there, Raza, thank you. So yeah, I'm Sarah. I'm currently working at the University of Manchester. I have a background in neuroscience. I'm a fellow of the Global Brain Health Institute, but if you asked me when I was 10, I would have told you I wanted to be a cartoonist and illustrator. So my path has actually led me back round to creativity now, and I work in aesthetic focused care for people living with dementia. So I'm really interested in beauty and creativity and the smaller things in our everyday lives which are really important to us. But today I'm going to talk a little bit more about play, which I think is a huge part of creativity. And as Raza was just saying, it's a wonderful way to learn and to fail in a way that still seems fun and accessible. So I think play is a lovely way to fail. I enjoy failing. I do it all the time. So as Raza mentioned, we have a special interest group. When we spoke to creative professionals, researchers and members of the public, what kind of bubbled up to the surface were these probably two kind of themes. So this was, as Raza mentioned, communication, but also this creative problem solving and failure. So thinking outside the box, being able to, to just think a little bit differently. Now, the reason I have this lovely graph on here is that actually this is really interesting from an evolutionary perspective, and probably not so surprising either. So you can see here that studies have found that species who display this higher social tolerance, and especially those who live in cooperative societies, so that's the solid red line. So this is like, we've got the African wild dogs on here, we've got the bonobos. What's interesting is these animals actually display much higher levels of adult play. So it's not just the young animals that play and learn and fail. It's actually the adults that are doing this in a kind of social setting. So what we think, or what is thought, so there's studies around this, and I'm happy to share links later if people would like the papers. I just didn't want to clog up the slides with too much information, but we think that play and creativity between adults actually reduces aggression. So there's some studies around neuroscience that looks at the way that these activities reduce certain transmitters in the brain, but reduce aggression. They also increase this pro-social behavior and have the ability to kind of synchronize group activities. So that basically means that the group will favor collective decision making and working together rather than working independently and doing things separately. So I mean, roughly translated, this is coming back to what our workshop attendees were saying about creativity. So improve communication and that ability to synchronize, to work together and to solve problems. So this is something that's kind of intrinsic to us all, and we use a lot as children, but kind of I don't think we use enough in our adult lives. Now, with that in mind, I hope you'll indulge me, but I wanted to play a little game with everyone. It should be quite easy, hopefully a little bit silly, hopefully a little bit fun. I'm hoping it'll get you into that receptive place where you can digest the rest of this information. Okay, activity. Thank you for changing slides, Raza. All right, so do we think as a group we are going to be able to count to 10? Can you count to 10? Can we do it together? Let's see. And I'm hoping that the chat is going to work for this. We can also do it out loud, but it'll be fun to try it in the chat first. So what we need to do is count to 10, but we don't want any duplicates. So if there is a duplicate number, we have to go back to 1. You'll be typing in the chat. You can only type 1 number at a time in the chat. And the aim is for us to be cooperative. So if I was to type 1, someone else has to type 2. And so on and so on. But of course, if we get to 3 and 2 people type 3, we need to go back to the beginning. We need to go back to 1. So I'm interested in how high we're going to get with this and how far we're going to go. We're not allowed to speak, but if people do want to put their cameras on, we're able to look at one another and we can maybe smile and wink and whatever else we need to do to get this done. So I'm going to start us off with a 1 in the chat. Oh, Well, we've already got a duplicate, so I'm not going to start off with a 1. We have to start again, guys. Try again. Oh, let's try and get to 3. See, everyone's scared now.
It's even more fun if there's a delay for someone.
Failure live.
Now everyone's afraid.
Oh,
Oh, I like you, Richard.
We've got to 10. Thank you, Richard. Awesome. Okay, I'm going to cut it because we do have conversation to have around this, but I think we got to, did we get to 3? We got to 3. We got to 3. And to be honest, given how many of us there are in the room, I think that was really good. So well done. I hope you've I saw some people laughing. This has just been a little bit silly, but I hope you can see that maybe that's put you in a little bit of a receptive kind of more silly mood to engage in the rest of the presentation. So I'm going to hand back, cluck. I'm going to hand back to Raza and I'll come in again later, but thank you, everyone.
Thanks, Sarah. It's such a shame we don't have time for you to explain the different physiological states that play puts us into, but never mind about us explaining. You can feel it if you've done the counting. I certainly can. My cheeks are hurting. So, you know how I said you buy 1, get 1 free, for 3 for free, that is. You may have tweaked there's a little bit of that kind of flavor with the questions. So we've done the why and we've done the how, and I'm just very quickly doing the when. So if you've been involved in any form of public engagement and involvement, you will have seen this wheel in some form or the other, not necessarily this version, but the wheel that says PPI is not something you do when research has started. I mean, hopefully it's something you do as well as other things, but it's not the sole thing. When you can involve people with lived experience or the public, starts from the very beginning when you set out research priorities, when you decide what research should look like, look at in the first place. I'm still reeling from the game, you see. And you can carry it on all the way to creating impact, to disseminating together with people with lived experience. So, well, we couldn't really go through all 8, not in the time that we've got. So instead, we would like to give you 3 examples of different stages of this wheel: the beginning, the journey, and the kind of impact. I don't want to call it the end. We kind of hope research cycles keep on twisting. But we wanted to talk you through of what in practical terms it would look like and what those whys might be. So I'm handing over to the excellent Nikki Taylor now to tell you a little bit about beginnings. Nikki, you're going to have to Chris Whitty me.
Hello, I'm Nikki Taylor. I'm a research fellow at Leeds Beckett University and a fellow of the Global Brain Health Institute. And the example that I'm going to share with you is funded by them. My background is in community arts, and my research and practice background is specialising in working in co-production with people living with dementia. So the example I'm going to share with you today is a project where we were looking at how people living with dementia can be successfully involved in the co-production of a research centre for theatre and dementia. So co-production might be seen as kind of a very in-depth form of patient and public involvement, where there's a real focus on working collaboratively and taking action together. So I would like you to put yourself in the position of a person living with dementia who might be considering getting involved in research, patient and public involvement. Can you move us on, Rasa? Brilliant. So I would suggest that people with dementia are considering a few things when they're weighing up whether or not to get involved in patient and public involvement. And considering that people, when they're diagnosed with dementia or have been living with it for a while, they're already experiencing quite a threat to their sense of confidence and competence. So the sorts of questions people might be asking about getting involved is this invitation really for me? How do I know that I can contribute meaningfully to the project? And how safe will I feel? So I'm just going to look at each of those in respect of the project that I'm sharing with you today. So Rasa, can you move us on to the next one? So is this invitation for me? How are we presenting what we are asking of people? And I would suggest that creative methods absolutely make patient and public involvement more appealing. So people will be asking, does this look interesting? Will I enjoy it? Will it be any fun? And when people are already experiencing challenging circumstances in their lives, will it be a worthwhile use of energy and effort? So the very formal kind of research framework that is incredibly useful to us as researchers when we're putting grant applications together and stating exactly the process we're going to take, that might actually be off-putting for people living with dementia, and presenting something in a very formal way might mean that certain people discount themselves straight away. So thinking about the rigidity of our research world, is it fair to ask people to step into that, or are we under more of an obligation to shake things up a bit and offer something a little bit more open? And I think that creative methods absolutely open up more engaging ways. So one of the benefits is that there's an immediate personal reward from being involved and being active and creative. When we're asking people to touch and explore and move things around, we're asking people to be active and creative. Next one, please, Rasa. Okay, so will I be able to contribute meaningfully to this project? And that's something that people living with dementia will be asking themselves. So are we only interested in people who can join on a Zoom screen and sit individually contributing in a very verbally articulate, turn-taking and kind of rational way? Do they have to be able to use technology in order to join the group? And I think if we only offer that as an opportunity to get involved in patient and public involvement, we are excluding a whole range of people with dementia who have different communication strengths. So using creative, collaborative approaches can help people's nerves to settle, it can help build rapport, or offer totally different starting points for contribution. So in this group, for example, there's a couple taking part together, supporting each other to engage in the activity. And they're using gesture and movement as well as words. So the pressure of verbal communication is absolutely lessened by the creative involvement. The fact that there's a visual stimulus, there's texture, people are able to place objects. And even if people find it difficult to get started, they then build on each other's creative efforts. So I would argue that if we offer more engaging methods, then we will gain more balanced insights in patient and public involvement groups, because we'll be going beyond the usual suspects of people who can join a Zoom meeting and have really, really rich opportunities for engagement. But I do think we have to be really open and honest about what we can facilitate as researchers, because it is skilled work and it does take time to develop these skills. Next slide, please, Rasa. So people might be considering getting involved and thinking, will I feel safe in this group? How safe am I going to be? And this is a really crucial question, because we don't do our best work when we feel unsafe. So people might be thinking, am I going to feel like I'm under a spotlight in this group? Are my challenges going to be exposed? Is it going to feel lonely or pressurized for me? You know, are people going to be staring at me, waiting for me to speak? So again, creative approaches can disrupt the formal constraints of a meeting. So in our group, it's fine to stand up, to move around. It's fine to pick up pens and to write, draw, mark, make, to arrange leaves and stones to express how important you feel a topic is. So expressing ourselves in different ways without words, a person with dementia might be able to show what they mean rather than having to struggle to find words that they don't have to tell what they mean. Again, I think the key factor is really careful facilitation of these processes to bring out the best in everyone. And then with that, you get the potential for really rich contributions when people have that grounding of feeling safe. So I'm now going to hand over to Esma, who is going to continue this topic.
Hi, everyone. Thank you for the introduction. So my name is Esmond Belajog. I work as a senior lecturer in fashion design at the University for the Creative Arts. I'm also a PhD candidate and also the co-chair of the British Society of Gerontology Creative Aging SIG Special Interest Group. So I'm going to be talking to a project and then my own personal work that I am doing. So with the Culture and Memory Archives, I was involved initially as a volunteer. And to give you an overview of this initiative, it was a case of celebrating the 71st anniversary of the Windrush, the docking of HMT Empire Windrush in Tilbury in 1948, and also an opportunity to bring together a group of people who might feel isolated in their environments, and to bring them together and actually celebrate something very, very significant to all of them and to their families. So it's very much an innovative approach. So it involved inviting people from day centres, care homes, different environments, living with dementia, to a multidisciplinary event. Next slide, Rasa, please. And this event involved lots of different things. There was an installation by the artist Michael Macmillan. This installation is called The Front Room. There's a book that a catalogue that supports the initial exhibition that took place at the Jeffrey Museum back in 2005 to 2006. And this installation recreated a sort of a living room environment with all those sort of knickknacks and pictures and you know, a basket full of wool and knitting needles and crochet, all the things that would have been beautifully displayed in these environments. So that was one of the spaces created. Other activities involved storytelling, music, you know, food, and just various things, just to recreate that sort of celebratory atmosphere. So you can see in the pictures there's all sorts, and there's a man playing his flute, there's a spoken word, there's Michael Macmillan engaging all the people gathered in his storytelling. I'm there in the background, sort of knitting away. I found the most comfortable sofa in the installation. You know, found myself knitting away and having people want to talk to me about what I was knitting, actually, male and female. So that was great, you know, sort of live activity in this space. So this took place in central London, so it actually doubled up as a sort of day trip for all of the people involved. Next slide, please. So that event took place in 2019, just before COVID-19 sort of hit us, or was about to hit us. So in terms of the next stage of this project, I was commissioned to add to this sensory box. Still the same project, the memory archives, but what this box did was basically take the learning and from the live activity in terms of what worked and what the people in the space responded to well. And so what it ended up being was a condensed experience in a box. I contributed to it in terms of something tactile. So in my research, I teach fashion, so I'm interested in fabrics and the storytelling capacity of fabrics and textiles. So I contributed something that I came across a lot in terms of the imagery and conversation, sort of raffia, embroidered raffia that often might be something that's a souvenir, might be something that was actually used, in the day-to-day. So I handmade over 40 of these samples. They wanted a collection, they wanted 40 boxes, which they were going to sort of distribute and send out. So each one is very, very unique. And that was a sort of tactile element. Then also in this box, you had sort of cinnamon sticks, you had the spices. There's a little sort of speaker with this sort of music. There's all games, dominoes, all these things that would really, that the individuals could really engage with because they were meaningful, they had meaning. And that's the thing, actually. I mean, in terms of how people engage, one has to understand that, like us, not everything is relevant. We don't see everything as relevant, or we might not necessarily want to engage with things. So it actually takes some work to find out what is relevant. How can I get this person to enjoy this activity? So it has to have relevance. So whether it's sort of cultural relevance, but it has to have relevance. And so yes. So on to the next slide, please. So this is me in a care home, and with my pop-up shop, which basically had hats and crocheted doilies, a cricket bat jumper, as you can see, a pattern for sewing garments. And this pop-up shop really invited the people in the space to pick and choose. I mean, like we all like to, when we are faced with objects, the actual act of choosing something, showing your agency, making a choice and differentiating from this on the left, from that on the right. It's very, very important. And obviously by choosing something, there's a reason why you've been drawn to this object. And often that reason is sort of, is aligned to a story, a dress narrative. So just to pick up on our previous speakers in our little segment, creativity has the power to draw everyone in. It doesn't really discriminate in a sense, really, because people will choose their path into something, to that particular creative experience. So yes, I think I'm going to finish there. So handing over to the next person, handing over the baton.
Brilliant. Okay, well, I'm just going to come in a little bit here about the creative engagement and the not necessarily the last part of the research cycle. It will obviously feed back in again since it's a cycle, but kind of getting a message across to en masse to a wider audience in a creative way. So for this, I'm taking us back to 2016. Does anyone remember 2016, pre-pandemic? Feels like a different world. Some of you might remember that back in 2016, the NHS had just scrapped its medical data sharing platform, care.data. The idea of the platform was it was meant to smooth the sharing of mass medical data for research purposes. But let's just say, I can't go into detail, but the implementation was mishandled. The public felt very uninformed, and confidence in data sharing, even for medical research, had pretty much plummeted. And we probably know this was a problem for researchers like you and I. So at this time, I actually wasn't in research. I'd taken a sidestep and I was working as a public involvement officer with a university team who analysed health data. So with researchers, but not specifically as a researcher myself. We saw this problem, and obviously we were experiencing it because we were trying to get access to this data. We knew a lot of people were losing trust and deciding not to share their medical data. So we wanted to develop an engagement activity. We wanted to open this dialogue around data sharing, and we wanted to reach a really big audience. So what we decided to do is we wanted to develop an activity and show it off at the Blue Dot Festival here in Manchester. So I don't know if anyone in the room has been lucky enough to come to the Blue Dot Festival. It's a really nice festival. It's a science and music festival which has stalls, activities, and loads of cool music in the evenings. So it was a nice place to do this. But it did have a turnout of between 8,000 and 9,000 people, with people from all different backgrounds and families, so we had to appeal to a lot of different people. So that was our problem, and I'll go into a little bit about how we solved it. So next slide. Lovely. I say next slide. I'm also going to go on to my next slide so I can read what I'm saying. Sorry. All right. So we were really lucky in our department because we had an embedded PPI group. So I managed a group of around 15 members. They were from all different backgrounds and all different ages. So we came together several times to discuss basically what message we wanted to get across and how we wanted to do that. We had a think and we had a brainstorm. We decided that the best way to achieve this is we wanted to develop an activity that would provide the information, but would also encourage people to process that information themselves and draw their own conclusions. We wanted them to be able to reach out and touch the information, manipulate it themselves, and think about it and work out what they really thought of it. Because when you draw your own conclusion, it's kind of more solid. It's kind of something that sticks with you for longer rather than you being told something. So after some brainstorming with the group, we thought we would develop a game. None of us in the group were game designers, so we were lucky enough to get a small funding pot from the Wellcome Trust, and we invited a game developer to join our meetings. So they worked with the research staff in our department, myself, and the PPI partners. They had to work out what information people wanted to share, whether or not they thought it was right to share, and they wanted to know, about medical data and how researchers would use it. These meetings were a really creative space, and we were literally playing with the ideas, which I think really helped us. So we eventually came up with this activity, and we could develop and test it at a smaller gaming festival in Manchester. By this point, though, I'm going to say is that it was largely ready to go because we had this lovely iterative, playful process where we did fail a lot and we came up with things that didn't work. But because we had our PPI partners with us and we were working together, we were able to identify, well, that doesn't make sense to someone who isn't a researcher. Let's change it. Let's do it this way instead. So by the time we got to the first live test, it was pretty much good to go. But after a few tweaks, we made it into this role-playing game, this very big kind of fun role-playing game, which we rolled out at the festival. So I'll tell you a little bit more about it, but I won't go into too much detail. So next slide, Raza. Okay, the outcomes. So input from these PPI partners that we had already in-house, it told us that to be successful, they wanted us to talk about the medical need, how the data was shared, and what researchers are doing with that data once they have it. It's actually quite a complex scenario that to get into a game that's going to be quick for people to play, but also educational. So what we came out with was a game that followed the course of this fictitious disease. So the players split into two teams. One was working in a fake hospital treating patients, and the other team was working in a lab looking for a cure. They both communicated, not directly, but through this kind of data sharing conduit. And that required certain data safety protocols to work properly. Protocol sounds terrible in the game. I think it was actually throwing a ball into a box so as the kids could do that bit. But, we explained why they were doing that. And if it didn't work properly, the team would lose public trust. So you had kind of a little measure of public trust as you were going through the game. And that kind of justified how much information you were getting about the condition. So if the groups worked well together and they shared data well, they could find the right cure and save those patients. If they didn't, well, that's another outcome. But it was a lovely combination of serious and silly. So we obviously had the message coming across, which was quite serious, and people did engage with that and connect with that. So you can see a few quotes on here from people who are saying what they learned from the activity itself. But we also had the silly bit where children were able to play games, pressing buttons, throwing balls. So everyone had a fun time. So it was a nice combination of the serious and the silly. Our PPI group suggested that we had delivered this as a game. So just going back a little bit, because what they did is, and I think this was great, they understood the power of play. They wanted people to experience a problem on this small scale and in a fun, failure-free environment where they could do what they want and it didn't have any outcomes really other than a fictitious patient dying. So amongst all these smiles, laughter and play, the people did learn and they came to their own conclusions. So I might be running over and I apologize, but my take home for this is that the creativity helped make that experience possible. Not only did it encourage people who came to our game to evaluate the information and come up with their own conclusions, but also there was a lot of play involved in developing it, which I think made it, you know, so smooth and helped it pull together. But also, I just want to say there's a but. It was complicated. This is a really complicated topic, and to present a game in a way that people understand why you're doing it and what they need to learn from it. There's a lot going on beneath the surface. I wouldn't have been able to do any of this as a researcher, I don't think. So being a PPI officer at the time just gave me the capacity to work on this with a little bit of funding we got. And also having members of the public join me on the journey really helped me understand what people didn't understand, what needed to be in there, and what was confusing and what wasn't confusing. So we got these issues early on and fixed them before it even went to test. But sorry, I apologise. I think I might have gone over there.
That's lovely, Sarah. Thank you so much. That was absolutely brilliant. And we're going to hold questions for you until the end because our next speaker needs to go at 1 o'clock. So we're getting tight on time. So keep your questions. That was a brilliant presentation. Thank you so much. So the next, we've got a few examples coming up, and next we have Cass Sykes, who's the implementation lead for the ARC's Living Well with Dementia theme, and she co-leads on digital inclusion. So she's going to talk to us now about creative approaches to developing a manifesto for a national network with dementia. So over to you, Cass. Thank you.
Thanks, Vanessa. So I'm just going to talk about this particular co-design of the manifesto today. I'll just share my slides, which aren't as creative as some of the others that we've seen today, but the engagement was creative. So I'm part of what's called the Dementia Network Plus Empower Network. And this is a, I don't know whether many of you have heard of these Dementia Network Pluses, but they are, they bring together disparate communities. So those are research communities, they're clinicians, they're people living with dementia, they're carers, they're voluntary sector organisations. And with the aim of this particular Network Plus was to identify, prioritise and develop emerging research, knowledge exchange and challenges, with a view primarily to improving outcomes for dementia. There's subsequently been one that's been working on looking at innovation in dementia as well. And it is funded through the UKRI, through the NIHR, and also through the Alzheimer's Society. So the Empower Network is one of 4 networks that were funded in 2023 for 2024. And this network has a lot of partners, as you can see on this slide, and really quite varied as well. So King's College London is leading this network, but in our region, we've got Brighton Sussex Medical School and also the organisation I work for, Health Innovation Kent Surrey Sussex. My involvement primarily in this network is for digital inclusion, but again, that's not what I'm talking to you about today, but very aligned to what we are talking about. So one of its 3 aims include to work together and find creative ways to make a positive difference in dementia care, to hear the voices from marginalised, vulnerable and underserved groups. So this particular network is really about improving the outcomes for that particular for those particular communities, and to find ways to do research that mean more people with dementia can take part. So creative design was absolutely key for that. And co-production is also absolutely key. So really focusing on a collaborative approach that prioritises equity, shared power, shared responsibility among all the participants in a safe space, and ensuring the ongoing involvement of those diverse and inclusive groups from the outset. So the way we approached this was established. So back in October, myself and other people from the network went to a sort of co-design workshop in Upper KCL, where they set up a sort of a process for how we were going to then go out to our communities and conduct our co-design workshops. So we attended this launch session, and then a number of workshops have then subsequently taken place across the UK, and that's in existing forums such as memory cafes, or bringing together people for a bespoke session. They had a theme which was nature and pollination, so the pollination of ideas, but I'll come on to a little bit about that in a minute. And then also we had 4 activities. So the workshops were actually between sort of 4 and 5 hours long. They were quite slow paced. We had warm-up, so the picture you can see here is the warm-up exercise. This was everybody sort of doodling on a bit of paper just to get warmed up and up and walking around. The other thing that we did was, and it was part of the sort of the plan, was to ask everybody who was participating for songs to do with, you know, how they felt, what made them feel positive, what made them think of nature, what made them feel happy, with the intention that we would play those people's favourite songs at the event. But I'll come on to that as well, because that was quite interesting, how people's response to that. This was an example of the first doodle that happened. Then we had activities 2 and 3, so we wanted to know why people were there and who they were representing. And then we had activity 3 was about pollinators, and that was to develop the key values for dementia care in the network. And we just had lots of finger painting, it was lots of gluing and sticking, and it really was just really fun, and everybody was able to get involved, which was brilliant. And then after that, we then developed each table, or each group then developed a 5-point manifesto for equitable dementia care. This was based around a tree. And then we also had a tool shed, so that was the tools that were needed to deliver the manifesto. And then we had a compost heap, which we got challenged on, because it wasn't so much what we wanted to recycle, it was quite often what we wanted just to, you know, completely get rid of. So the result. So I don't have the manifesto to share with you today yet. Those findings, so I'm not sure how many happened in the end, but there were a number, you know, there's probably well into the 20s workshops that have been conducted using that sort of format. It took a while to warm people up. We did have one table, and it was interesting that I wondered if it was just the participants on one of the tables that we held in Sussex. They really didn't like the music, so we can have the music on it, but that might have been sensory. There might be many different reasons for that, but they also didn't feel that being creative and doing this was they felt it infantilized the seriousness of the topic matter. But all the other tables absolutely enjoyed it, and it was a really lively and enjoyable workshop, and we had really positive feedback. So the only thing any other sort of feedback I felt was things like pollinators. So this idea of nature, it made sense, but pollinators isn't a particularly easy, you know, it's not, it's quite, I think it's quite a difficult concept, and that's probably why we ended up with pictures of dogs and other, you know, other animals as well in our pollinator session. But and I think conceptually it just took a little bit of time to get people around to thinking about what we were trying to achieve, what the theme was, and it perhaps distracted a bit. So I think getting that theme right is absolutely key. So I'm going to stop there. Unfortunately, that was quite a quick presentation, but if there are any questions, I do have to leave at 1, so I'm happy to take any now.
Thank you, Kath. Do people just want to shout out, because I've got so many cameras on my screen? Just go ahead and ask. I think it's a really interesting point about the level of the creativity and whether it's seen as infantilizing or not. Because as an occupational therapist, that's something that's often come out in activities in a mental health setting, well, you know, it's not really age appropriate, or not, it's not something I normally do. So I think that's really interesting, how you've got to try and match those two sides of the activity.
Yeah.
And also what one person likes, somebody else doesn't. So for example, with the music,
Yeah.
I can't see any hands. Oh, somebody, Sarah, go on.
Sorry, Vanessa. Yeah, I just wanted to say what you were saying, and I think that that's why, in terms of the difference between art and creative thinking, I think that sometimes it's really difficult within research to kind of be creatively thinking on the spot and adapting to people's specific needs. So I'm not at all surprised that the exercise isn't for everybody, and I think that's the danger, that we can't really assume that creative methods are the best way for everybody to communicate. But I suppose it's about, obviously, like it hit home for some of the demographic, but it is hard when putting in an application to kind of go, it's co-produced and we don't really know what methods we're using. And I think that's where, like, trusting creatives and creative process really does come into play. And I don't think it's a failure of the method. You could obviously say the same about the difficulties in qualitative data, but I think it's really, like, a great point to raise, that it's not for everybody.
And it was interesting because it just seemed to be one table, and they were all, you know, whereas every other table, I just wondered if it wasn't that particular group, whether maybe they would have, you know, got into it a little bit more. But yeah, that was their feedback.
We've got one more question from Anna. Have you got time, Kath?
Yes, that's fine.
Hiya, thank you. Thanks very much. It's been really interesting so far. Thank you. As someone who's not really artistic at all and doesn't really have any creative skills, I've always felt quite scared of any sort of artistic, any sort of approaching PPI like this at all, really. But it seems from looking at, say, doing things like doodles and keeping it quite simple, that seems, maybe that's a way that's accessible to everyone. It feels like most of you have got quite good artistic talents that you rely on. So I was just thinking, like, do you think anyone really can do it, or do you think you do have to? I know I really thought it was interesting saying about it being a really good equalizer. You're all in it together, sort of thing, and that's great. But do you think, for it to be effective and worthwhile for people, that you need to have a level of skill or an interest there to begin with? I mean, not an interest, a level of skill, or a skill's the wrong word, maybe a love of it, or wanting to share it. Do you think you need to have that, or can it be used for people that don't have artistic skills, creative skills?
I mean, absolutely, there's a real mixture. I mean, I did put a picture of one of the more artistic ones, but it was I think what was good was there was a real variety. So we weren't asking people to paint masterpieces. You know, some of it was like fingerprints, and then turning that into turning your sort of fingerprint paint into a bee or something, or just take a couple of legs on it and turning it into so some of it was, you could have made it as easy or as difficult. We had stickers, we had stencils, so people could have just used stencils as well. But everybody, apart from that one table, everybody really, really got into it, and it was just really fun. There was a real buzz in the room, and everybody said they really enjoyed it. So but yes, I think that's the key thing. And I think making it really, you're not expecting a masterpiece, and making it as varied so people can just do sticking or whatever. I think that would be the key thing.
Thank you.
Sarah.
Yeah, sorry, I didn't know if it was okay to speak to the question, but I've just written something very quick in the chat. But I think it's a double-edged sword. So you wouldn't ask someone to compile a survey who didn't have the necessary background to understand how that might look and how that might work. So I quite strongly say that there are people who are already working in this area who should definitely be consulted on it as part of the co-production. But that is not to say that you wouldn't be able to facilitate something if you felt that you didn't have the artistic, as you say, like, you're definitely creative, everyone is, but background. But but you know, it's about, I suppose, getting starting points and also working with the people, nothing about us without us, working with the people who prefer to communicate in that way, and they may even be able to lead that and discuss how they prefer communicating in the same way as you would with any other public advisor, giving them the options to record or write or speak. So it's just the same thing, really, essentially. But the other thing that I wanted to say was just about when you're working with specific communities, it always comes down to people who have relationship built within those communities. So, for example, where I am in Folkestone, there's a community that I've built with mental health and art, and that's what people understand happens in the space, and that's how we reach the so-called hard to reach people, because that trust has been built and gained. So I think swooping in and kind of doing creative methods in a situation where people are not used to that is gonna be tricky in the same way that you wouldn't go in and sort of just extract data in a traditional sense. I hope that all makes sense, but yeah.
I think maybe sort of my
Thanks,
like fear, my slight fear of it sort of transcends into how I then think other people are going to be scared of it as well. So maybe I just massively project my own fear of having to do anything, you know, creative. So that, yeah. Okay, thank you. Thanks a lot.
And
Yeah, and I suppose practice makes perfect, of just kind of maybe doing some sessions for yourself outside of that environment, as you would with practicing for a survey, kind of practicing the techniques and familiarizing and then feeling confident yourself. Sorry, I'm going to shut up now.
Well, do you want a final comment from Lou, and then we'll move on to our next talk, which is back to you anyway, Sarah.
Oh, fab. Thanks, Vanessa. Anna, this is kind of, it's just leaning into kind of, you know, what you've just talked about there and that feeling around it. Being someone who is the public community involvement and engagement coordinator here at the ARC, fundamentally my role a lot of that time is, you know, engaging, working, supporting with our public members, and looking at different ways we can do that. And there is the standard way of, you know, almost like a script, isn't it? Here's a document, you read it, feedback, etc., very stagnant. But we also acknowledge that that does work for some people. It absolutely does. And there's a space for every approach. And I think what we've kind of leaned into within the public community involvement workforce is that using creative methods and approaches has its place. We are sometimes uncomfortable with it the first time that we do it. And we may think, oh, actually, we're not creative, we're not artistry, we've not done this before. I feel nervous. Am I going to deliver well? Am I going to engage in it? And what we've all come to develop and maybe learn is actually sharing that within the group. So that empathetic approach, that, you know, being honest and transparent within a group setting, if you were to do that creative approach, is that actually, you know, this is the first time I'm doing this as well. So we're forging this together. You know, so we can develop this, we can share how we feel about it, our comforts, do we like this method of approach, etc. So sometimes we don't need to go in as seen as the expert who can do this, but actually more on that level with them, that we are learning this together, and that forges that trust and that relationship building. And sometimes that approach works really effectively. We have in our approaches sometimes had members who have instantly said, I don't want to be involved in this creative, I'm not, and that's okay. There's space for you to sit, you know, please, you know, they can facilitate the meeting with you, they can be involved in other ways, you can lean into how they feel, and the group dynamic supports that, but it still works as a creative approach. And you kind of come away from it thinking, actually, that was really great, and I did really well. So I think leaning into how you feel, and, you know, sometimes letting our guard down a little bit, and being empathetic and open with the public members who are doing that with you, that we're on this journey together, this creative journey. So I hope that helps a little bit, but that's anecdotal of my experience.
Thank you.
Thanks, Lou. So we've got two more examples from Sarah and from Lou. So Sarah went on a community participatory action research training a while ago, and she's developed a project, or many projects actually, but including a variety of creative approaches within its design. And she's going to tell us about one of those and also the project outcomes. So back to you, Sarah. Thank you.
Hi, thanks, Vanessa. Yes, so I wanted to start out by simply saying that we documented our process the whole way through the 6 to 12 months, I can't remember now, as a form of a report. So we pushed back on the idea of enforcing a report on our community who wouldn't want to express themselves in that way. So I want to just share the video with you first and foremost, and it should give an introduction, hopefully, and introduce you to some of the public members that took part. Thank you. Would it be better if I tried to screen share?
I think I just didn't click on the share sound. 2 seconds. Include
Okay,
sound.
so-
There we go. Sorry, 2 seconds.
Right at the start of the What Cost Folks project,
Can you hear it now?
I actually found a call out for grassroots organisations to become community participatory action researchers.
So What Cost Folks is a research project. It's a community action research project, the idea being that the people involved in the project are members of our local community here in Folkestone, and we help facilitate conversations, make artworks and find out how the cost of living crisis has impacted people's mental health and well-being.
And it's looking at ways in which we can action change, but it's led by the voice of the community. So it's all co-produced, and we're trying to use creative methods so that we can open up fresh dialogue with those people who might not already connect with any research projects or academics.
So our first part of our project really was opening in September 2023, and we opened up this space. We had art tables out with art equipment, and people could come in and make, and they talked about what they thought about mental well-being, what they thought about the cost of living.
So some of the conversations we've had in here might be about things that could be quite challenging, but it's a safe space to just talk about it.
So our first workshop sessions were all about understanding what the community wanted this question to be that we researched, and then that led to us deciding that the main question is, what are the needs for the people of Folkestone for good mental health, and how does the cost of living impact that?
When we started doing the outreach, we sort of built on that and looked at the needs and barriers that people were experiencing, and that really helped us lead into the writing prescriptions phase of the project.
We put all the artworks up on the wall, and we got people to come in, and we asked them to think about what the needs and barriers are, and they got to write down what they felt Folkestone needs to make it a better place to live, for especially thinking about the mental health of the people here. We then did some sessions with specific groups from the What Cost Folk community, analysing the prescriptions. And so we made a giant spreadsheet wall behind us using masking tape and a massive grid.
That was an extra bonus to have that kind of that experience of like analysing. But I think that what really stood out for me was that there is this hole in the community where people do really desperately want to come together.
So at the end of our analysis, we decided to create 4 big prescriptions focused on specific stakeholders we wanted to reach. So a key stakeholder that this project is definitely trying to talk to is the NHS. But through all our findings, we realised that we need to be talking to the council, we need to be talking to government, and we need to be talking to arts funders as well. So we looked with our community at who we need to get our message to, and so the community could have their voice heard by those groups of people, we hope.
We need these support services, and I think the more that our government, our politicians can see that, it's hopefully drives that change. But it's small things as well. I think, you know, you look at the prescriptions and you look at the wall and what people have written, there's understandably a lot of anger in there. But there are solutions, and some of them, like the friendship benches, are really crucial but really simple.
It's really opened my eyes to the needs, much more than I probably anticipated. There are challenges that we could probably do something about if we worked effectively together, and if we were listened to by people who are making big decisions. So I think the project has highlighted that there's a lot more to do. And what it's also taught me is there's a real passion and interest in creative activities to talk about these things. So that's very exciting for me because I'd like to do more of that.
Fourth Wall definitely is that sort of space I feel folks in needs it. I think what Sarah's done has been incredible, and I think it would be really cool just to get it out there and get maybe develop on what's happened in the project.
I think one of the best things that's come out of it is the number of people that they've got involved in it, because it's then opening that conversation and it's giving people a safe space to come to have those conversations, and it sort of helps dilute that shame a little bit, and they can have honest conversations and really feel that it's not just me.
I feel like we've only sort of started to scratch the surface, and the cost of living thing is still, I mean, it's still ongoing. It's still such a massive issue for people.
We're not going to get that, that quick fix. And so I think it's really important to keep it going, because I think nothing's changing imminently, sadly.
I think that the momentum now, obviously, as it's coming to the end, has really picked up. So it would be totally sad for it to just stop. I think it needs to carry on.
Yeah, the project's made me feel really hopeful. As researchers, we've got a lot of thinking to do about what we have achieved, what we feel that we could do better, and reflecting on this as a case study and a pilot. This is just the beginning. Thank you. So yes, that was an overview of the project and Fourth Wall as a space. I've got a few slides to share, just looking a bit into the different types of creative research methods that we use within the project. But to give you an idea, we reached about 1,000 people during that project, and people were doing it across the country in various different ways, and kind of maybe producing sort of 12 interviews. And I know it's the quality, not necessarily the quantity, but it just kind of shows how many different people you can engage. And the other thing I wanted to point out is that you would have seen a lot of writing. So again, not necessarily what you would expect from a creative research project, but it was about kind of capturing that data however people wanted to capture that data. And the creative part was being flexible on the ground to ensure that people could express themselves how they wanted to. So yeah, if I could just have my slides, and I'll go through them very quickly, because they were all very simple techniques, but it might give you a bit of an idea. So if we start from slide 2, that'd be great. And someone's just put a comment, and actually, yes, when the first project we're talking about how the actual benefits of creativity, within our project we kind of had actions along the way throughout, because people were coming together feeling less isolated. They were having a creative outlet, they were coming to what they would see as free workshops, they were within the community, and we're on a high street, so it was very front facing. So there was a whole bunch that I won't go into now, but of actions that come out of working in that creative way. People were able to sell their work, and the project was about the cost of living crisis. So there was just so much, it was just so rich, basically. Anyway, so we had drop-in creative sessions, as you would have seen from the video, and that was literally, we'd invite people to use various different materials. We started with collage, which is something that is quite easy for people to get on board with, because you're not starting with something blank, you're starting with something that is already an image that is in a book. You haven't got the blank page kind of fever. And we just asked the question, what does well-being look like to you? And so we had various different responses, and the whole way through the project we had this brown scroll, which was really important to document people's conversations, because as you can see out of the drop-in creative sessions, that it was, even if people weren't able to express themselves through the creative activity, it kind of built that rapport and that conversation and gave something to people to kind of fiddle with, take their mind off things, and therefore feel more relaxed in having a conversation. So the scroll we either wrote on if people wanted us to, or people wrote on it themselves. So the next slide. Thank you. So yes, photo walks is something that probably people may have heard of if they're looking into creative practices, but we invited people on social media to take part if they wanted to by taking photographs of the local area as a way in to start up conversations about how they felt about well-being in our particular location and what the needs were. Essentially that was a free exercise. Take the photographs, come and meet, and we had a final exhibition and people were able to submit some words alongside it as well if they wanted to. We had such a variety of pictures. We were also thinking about people that may not necessarily be able to leave the home but would want to document something and submit it. So this was a very easy way for people to take pictures around their house of objects that they might think represented well-being. Then we had Lego sessions. Now these were a bit of a surprise, and this is something where we talk about thinking on our feet, creative problem solving. We've received quite a few pictures from our local touch-based care centre who work with adults with learning difficulties. They came in actually and visited the space so that I could introduce the project, and we had lots and lots of pictures, but when we came to analyse the pictures as to whether they would tell a clear story in the same way you would analyse the text from an interview and pick out just small quotations, we realised that the way in which they expressed themselves through things like Pokemons and Sonic the Hedgehog, which is what we got repeatedly from them, we needed to kind of dig deeper as you would if you didn't feel like you had the information you needed from an interview and you wanted to go further and ask different questions. So we decided to go and work with them in their own space, and we decided to use Lego because it had that same playful element. It was something that was familiar, but we made sure to include nothing that looked like a familiar item that could just be repeated. So this helped information flow and imagination open up, and hopefully we feel like it helped people to express themselves in a more kind of fluid way. So we'd highly recommend playing with Lego, and we'd ask the question like, what did you want to see in Folkestone that might improve your health? I think you can just about see at the front there, they've actually created a friendship bench. But even just in making sculptures that make no sense, you're looking at colour, you're looking at texture, you're looking at configuration, and you're able to then discuss those things with people about what it is that they're building that is so important to them. And then we can move on to the next slide. We had prescriptions that I won't talk about too much because you saw them in the video, but basically they were prescriptions for Folkestone. And what was so brilliant is the fact that we then had we tried to follow kind of similar patterns that you would in a traditional research project. So we had the data analysis group of people who volunteered to come forward and started grouping the information that we'd gotten from everyone so that we could hone our focus in more. And it's just an example of how you can involve people through the process so that you're not making decisions on anybody's behalf. And we used quite a formal structure. We used like a spreadsheet, but it was completely different. It was on the wall. It had colourful tags in order to form groupings. So again, it doesn't have to be working with something with no information from the start. It can be written information, but just more creatively displayed and worked through. And then if we move to the next slide. Thank you. We did badge making. So people showed their concerns throughout the project of how it was making them feel discussing these issues and difficulties that we were having with the cost of living crisis. And someone said to us, there must be something we can do as individuals. What can we do in our local community? And we decided that we could create badges. So people did make a badge, take a badge, and they created the badges which were small steps, small actions that could come out of the research via prompts. So this one says, let's talk. So it's an invitation from someone that is a stakeholder within the community to have the community that he serves come forward and discuss things with him. People would make the badges, they would leave the badges, and they'd take somebody else's badge that they felt resonated with them. And that way, within the community, people had something positive to take away with them, and they were offering their support and their support to each other. So we found that really great, and we took photos of every single badge that was made. I think we had about 150 badges or so. And also I've been able to go and take them to symposiums and conferences. Unfortunately, this is online, but the ones that are remaining for people to take away and really kind of reflect on the topic and conversation. So that was a brilliant way to give something to people back, give something back to people as well. And then if we move to the next one. Yeah, we had open evenings and we invited stakeholders and the community in general, and we felt like this was really important to be sharing our findings throughout so that the voice of the community was definitely being heard. We were able to offer like private views and things for stakeholders so that we can have conversations just with them, but then we would ensure that they would open out later on into the evening to the community so that we had that cross-cultural conversation. And then at the end, as you just saw, our exhibition, there's a small glimpse of it with our photo walk, our scroll, and many other techniques that we use. I don't have a lot of time to go into everything, but we had this opportunity for people to come together at the end to celebrate and to show them that the information was there and being shared, and that became our report, and the video became our report. And I think that was really important for people to feel like the way in which they communicate is appreciated and it is not undervalued, and that they can have a say in the public realm. And to tell people, you know, I'm going to NHS England to show your work, and actually invite people to come along and discuss their work, has been massive in allowing people to understand that their experiences can lead to change. So I think that's my last slide. Oh yeah, there's a QR code there that links to, I think these are being sent out, so it links to the project itself on our website, and we had a social media account as well, so you can see a lot more and a lot more from the people that were involved. So thank you. That's me over and out, I think.
That's lovely, Sarah. Thank you. I'm going to hold questions for you to the end, if that's all right, or did you need to rush off? You're on mute.
No, I'll stay.
Okay, I just want to make sure Lou has enough time.
Yeah,
okay, so our third example is from Lou Lacey, who's the coordinator for the PCI team, and I have to say a particularly efficient coordinator. And she's going to tell us about an activity that the team did with the public advisors on an away day last year, which is a body mapping activity, which is always fun, body mapping. So over to you, Lou.
Amazing. Thank you very much. Hi, everybody. It's lovely to see you all here. And just on behalf of myself and the colleagues within the PCIE team, thank you for joining us today. I think this is a really kind of valuable space and a topic. There's no right or wrong with kind of creative approaches. I think we've already established that we all might not feel that we're good at it. Or that we are creative or artistic, but actually, you know, if we all learn on that journey together, we all develop together, and there is always a place for some sort of creativity or activity that will draw the best out of what it is we're hoping to achieve. So I think I'm just going to set a little context. I'm going to put my glasses on as well because I won't be able to read otherwise. So some of you may be familiar with body mapping. Some of you may not. So I am just going to give a very brief overview of what the body mapping is. So body mapping, it's a creative tool which can be used to foster kind of community engagement and involvement. It's combining kind of creativity and storytelling to create an interactive experience that allows everybody who's there, you know, participating in that approach to express their identities, their experiences, and to create a more interactive experience to allow for a kind of effective communication. And I think it's also a really good tool to maybe consider. It's a really good method for going into communities and using it in a space where communication may be limited to language barriers or kind of other sensory constraints, etc. So it is a really good concept to move forward and consider using if you feel comfortable to do so and have a go at it. Kind of the historical context of it, it was kind of the roots are in that therapeutic practices. So it's been used in various contexts, including healthcare, trauma care, recovery, and public involvement like you've seen today. And those benefits, again, like linking back to everybody what they've presented today, I think you can see that the benefits are all about that enhancing communication, that fostering empathy, that promoting kind of engagement and conversation, and the creativity of idea sharing and that self-expression. So within the context of how we've used it in the public community involvement and engagement team, this is our second creative method that we've used. So we first time we tried it, we did collage. Which Sarah Lloyd, you've just heard speaking, actually led that session for us. Both my colleague Pippa and I, when we first said about creative approaches, we were like, oh, we're not very good at it. Oh no, what if it goes wrong? And actually one of our public members, Sarah, this is her speciality, this is her field. And she really helped us. She helped us develop how we feel confidently with doing kind of creative methods. And the collage went down so well that actually we decided to use a different approach this time around. So within the Applied Research Collaboration Kent, Surrey and Sussex, we have a group of public members known as our theme advisors who support us with our different research themes projects, and they are involved as a member of that team, and they give their kind of critical advice, their positive advice. They talk to researchers, they engage in their projects, but they also link back with Pippa and I, and every second month we have a coming together, a PIN meeting known as a public involvement network meeting, where we give feedback, we give those the theme advisors updates, they give us updates, and we share ideas, etc. Now we do this as we're doing today, really in kind of a virtual setting, and we send out papers or documents and they have a read, and so it's that kind of arbitrary feeding back. So what we've tried to do is once a year have a face-to-face pin away day. The first time, as I said, we did collage. That was really effective. This time we decided to do the body mapping. So I'm going to ask my colleague Charlotte to share the slides, because I've got multiple screens open and I don't want to share the wrong one. So Charlotte, if that would be great if you could. Thank you. Thank you. Go straight from the second one. That would be wonderful. Thanks. Amazing. Thank you. Perfect. So kind of, as I've already said, myself, my colleague Pippa Shaw and Nadia Brooks, we organised our second pin away day, and we decided to go with the process of body mapping. So as you can see on the picture there, that's our public involvement network, that's our members, and that's some examples of what body mapping in its actual true form, its context, can look like. Next slide, please, Charlotte. Amazing, thank you. So why did we as a team decide to use body mapping this time round? It's been used before. Our colleague Nadia has used it in her co-production methods, and they had some very good engagement with it. So that's in a way why we decided to try it for ourselves as well. And what was the aim of that for the purpose of the PCIE team and our public members? Well, the aim of it was to create a more relaxed environment. So again, thinking about how we always do things online, thinking how it's quite rigid, how there's paperwork, etc. We were like, we want to come together, we want it to be relaxed, we want to encourage this open dialogue between myself, Pippa and our public members. So that's really where that fostering of that idea came from. So when it comes to putting that into practice on the day, we suggested that our public members, they got into pairs. We didn't pair match, we let them do that themselves, and that kind of was quite organically because they were already on tables in groups, and they decided to go off in their pairs, which is wonderful. We asked them to draw around each other or draw an outline of a body. If they were uncomfortable to draw around each other, please just draw an outline of a body. We as a team took the paper, took the pens, took all that creative things that we needed. Those as public members just needed to be present on the day and engage with what it is that we were asking them to do. And thankfully, on that occasion, everybody was really comfortable with it. Referring back to when we first did the collage, it was quite interesting that not everybody within the room was comfortable with it at the beginning. And this is where I said about us leaning into how we feel about it as well, and sharing our feelings about it, and acknowledging that creativity and different ways of expressing ourselves isn't for everybody, but we can work through it together. So in this instance, it was great. Everybody was really happy. There was a lot of laughter drawing around each other or drawing bodies. You can imagine people's different interpretation of what their body kind of was like on these pieces of paper. And we asked them to write on the body map in different areas. So, you know, we specifically went for the head. So you'll see on my slides, I've used some emojis. So we think about the head, think about the brain, that's our thinking aspect. We asked them also to think about the heart within the body. Think about the heart, we're thinking about empathy, our emotions, you know, we often say we think with our heart, maybe not necessarily our brain. We then looked at hands. So if we think about hands as community connectors, as those projecting, you know, hands that hold each other, that hands that hold the relationship. So we wanted to link that in with the community kind of connectors, and legs. So we asked them to specifically focus on the legs as well, because sometimes our legs can be tired, can't they? We want to do something, but actually we're a bit tired, our body's a bit tired. It can be a bit of a barrier. So they're the specific areas within the body that we asked them to focus on. Next slide, please, Charlotte. Thank you. So when we're thinking about these, the body map, everybody's drawn a map of themselves. We've asked you to think about these specific areas: brain, heart, hands, legs. What did we actually ask them? You know, what were the questions we asked? Because the purpose of the body mapping for us on that day was about collaboration, but it was also about feedback and information sharing, and doing that in a more relaxed way, as opposed to just, I'm going to ask a question, we're all just going to sit there, maybe think, dare I answer, do I not want to answer? This way, kind of, it was more relaxed. They were in pairs, they felt more secure, they had pen and paper, they were drawing. So what did we ask them? Why do you think research is important? So again, think about the brain. We're thinking, why is it important? What inspired you to be involved? So that's that emotiveness, that's that empathy, thinking with the heart. Who are you connected with? So we're thinking groups, communities, friends, other public partners who can support you and us in our research. And legs, are there any barriers to being involved that you have or are experiencing? And sometimes just relating it to an image, or in this instance, a part of the body, it really seemed to help to engage that conversation and that thought process, and them opening up about these different questions. Next slide, please, Charlotte. Thank you. So here's some images. Hopefully you can all see them there. This is a group working together in partners. You can see on the bottom left hand, there's 3 of our public members there, all drawing around each other on the wall. It created a lot of laughter. And I think that was really important about the laughter and the sense of relax, because, you know, these public members have been part of the ARC for quite some time. They meet, you know, every other month on a public involvement network meeting. They are comfortable with each other. However, they don't actually physically come together very often. So this for them was really important about their relationship building, about them getting to know each other better, because we can see each other visually, but that doesn't portray our character or how relaxed we are or how uptight we're feeling. So it was really good for them as well to come together. So you can see lots of different body shapes, lots of different things written on there, and really that cohesion of working together. Next slide, please. Thank you. And this is really important as well. This is one of our PCIE team members supporting our theme advisor who is visually impaired. And I think this is just to highlight that there are barriers for everybody being involved. and it is challenging sometimes for everybody, but if we work together and we express that empathy and we listen to each other, everybody can participate, everybody can be involved. And if I just reflect back when we did our first creative method of collage making, I worked with this public member who you can see here on the screen. And that was a really, really valuable moment and time for me, because actually that person was trusting me to be their eyes, for me to portray what they wanted to say. And it really made me foster a different way of communicating, and I had to take time to explain everything, and there was a lot of sensory and you know, feel this texture and this is what it looks like. So it's great activity for public members and us as researchers, public community involvement and engagement coordinators, to actually build our relationships up as well. And there are barriers there, but together we can get through that. Next slide, please, Charlotte. So this slide is just to show that from this creative method, this is what one of the questions, this is some of the things that we pulled back from it. So we went on to do a more specific report from this, but with those findings, rather than just collecting everything together on the day, saying thank you very much, this was a wonderful experience, and then thinking, well, actually, what are you going to do with it? This is part of what we did with everything that we collected on the day. So we kind of did word maps, we did feedback. It helped us as a PCIE team to focus our thought processes and how we go forward with supporting our public members. And one of the key quotes that came out of the day was, you can never have true understanding of something if lived experience is missing. And I think, Rasa, this is what you kind of applied and linked to at the beginning, actually, that we need that lived experience. We need the support of our public members and those going through difficult times that we are trying to maybe improve or develop, you know, for them. So it's really important to take their feedback and actually show them what you're doing with it after you've done this creative method, after you've done the creative approach. How do you then feed back to them what you gain from it? And again, sometimes it needs to be in that creative way before you then go and do your final report and put it into the way that it might be needed in the system. Next slide, please, Charlotte. This I've kind of done my own research cycle, but in the sense of body mapping. You know, it was a really, really valuable experience. You know, it's not only facilitating creative insights, but it's also connecting everybody to that physical representation of our thoughts and experiences. You know, our findings of this method encouraged an open expression and established a feedback loop for information sharing. You know, it was kind of integrating these insights, we can like enhance our understanding of community needs, of their needs, and improve our kind of engagement strategies moving forward. So I see this as, you know, a really positive cycle. So the body mapping, it's that creative insights, connected them to their physical representations, their thought processes, the question linked to a different anatomy of the body. It encouraged everyone to express their thoughts and experiences through laughter. And through sharing and through openness and empathy and kindness. And for us, it gave us that feedback loop of that information that we were actually, you know, wanting as well to draw from that day. And the smiley face in the middle represents, you know, that relaxed approach and how it was on the day and how we all left that day feeling as well. So I think, to conclude, the creative approaches in terms of body mapping, in this case, you know, it is a positive engagement tool. It can help to address barriers. It can foster that inclusive environment and ensure that effective engagement kind of promotes a dialogue with meaning. And of course, not all of us are going to be comfortable with this approach in the first instance. We might feel that we aren't creative. We might feel that we're not going to do it very well, but just remember, those in the room that you're doing this with may not have done this either. So you're all on the same page. You are all there collaboratively in that one space to you know, have an end goal that is the same. And the way that you do it is by doing that together and by listening to each other, and by sharing these experiences in a way that can just lighten the mood in some way, because often, you know, we're all talking about things that can be quite heavy for us, or it could be quite heavy experiences, and it can feel challenging, or sometimes you can feel that the dynamics in the room, you know, oh, you're a researcher or you're an expert in this, and you're asking me these questions. Well, actually, by doing it in this way, you all come to the same level, and it gives that relaxed approach to community engagement and involvement. Thank you, Charlotte. You can stop sharing. If
Thanks,
anybody
Lou.
does have any questions, please do feel free.
Yeah, let's go for questions for Lou first, and we'll work backwards. And I think I can I see any hands up?
I can see a comment that says, I've rarely left a creative activity without a smile on my face. Yes, it's informative, collaborative, etc. But I agree that it's also so much fun and a great way to open up and feel connected with everyone involved. Absolutely, Sarah. And the fact that you've left with a smile on your face, we might all go in with a little bit of a downward smiley face at first. We might all think, oh, you know, how's this going to go? There's that unknown, isn't there, the expectation. But we all come out of it feeling really positive and like we've all worked together.
I think it's quite interesting, Lou, because for me it touches on that sense of you're crossing boundaries in terms of getting physically very close to somebody that you really wouldn't normally. And it's particularly with the post-COVID, it's quite an interesting dimension to it. Absolutely.
And I think coming out of that post-COVID, a lot of things have gone online, and of course that is a wonderful place to utilize, you know, because geographically we are all spread out quite diverse. You know, we're all busy. You can have more flexibility maybe online, but actually, you know, what that has also done maybe is given that bit of divide to physical cohesion, given that little bit of divide of coming together, and in some way, you know, made us maybe feel less comfortable with that. And now everybody wants to bring everyone back together, but we can't just assume that we can do that and put everybody in a room for the purpose of what that event or that day is for, without factoring in people's feelings, their accessibility requirements, anything like that. So anything that we can do to lighten the mood and make it a softer approach, I think is always beneficial.
Thank you. I can't see any more questions for you, Lou, but you can always put your hand up in a minute. So let's work backwards to Sarah. Has anybody got questions for Sarah, either on her talk or anything, because hers is quite broad in terms of what we've discussed today? Any hands shooting up? Yep, Kat, go ahead.
Thanks. This has just been an amazing and such insightful time. Sarah, I was wondering for your project about what costs folks, just given the depth and the reach of your engagement, how did you deal with the ethics of that from a research perspective, and what was communicated to people in all the different ways they were engaged about how their data would be used? For example, you've done some creative analysis, and there's the exhibit. So I'm just curious, because it seems like a lot of participants to sort of engage in that process. And if you faced any challenges with like dynamic consent, people withdrawing, not wanting their contributions to be used, or so just a question about ethics. And then a question to anyone, because I've put in a bid with several partners. We'll see what happens this summer. But one of the issues around creative methods of engagements, we have several ideas, and we're working with all kinds of stakeholders, including the voluntary sector. And one of the points raised was the need to also not be prescriptive in the creative methods we put forward, and actually do a lot of bespoke work. So I'm just wondering if anyone wanted to talk about how they even, you know, pre-design phase, how they even worked with public members to actually come up with what are the ways they would like to participate creatively. Thank you.
Great. So I can start off, Kat. Thank you for the question. It's a good question. So we spoke a lot about ethics throughout the journey. So we were being mentored as community researchers at the time by NHS England. So I suppose we had mentorship, we had reflection and guidance as such. But in terms of ownership and consent, we had an agreement that pulling out a form for someone that might pop in for 10 minutes off of the street and want to contribute wouldn't be a great idea. But we were very clear that we were working towards a report that would be obviously a video report, and that we would be sharing work. So we actually were able to ask people, every single individual, if they wanted to remain anonymous, because of course some people actually would like to have their name against their work as well. And any work that they didn't want to share, they could take away with them. But actually at no point did anybody say that they didn't want to share any of the work. As we were having conversations, if people felt that they wanted their exact words written down, then obviously they could do that on the scroll, or we could. So there was that consent process in that way. But yes, it is tricky. But also the other thing about our space is that we do operate on an 18+ policy, and we did with this project. So we didn't prevent any children from taking part, or young adults, but we did keep it so that we would have 18+, and that everybody could make that reasonable consent. But there is something about I've been in several live conversations about the ethics behind having a trained researcher, a trained arts practitioner in the space, and whether or not this is helpful. I feel that there's a lack when it comes to funding in kind of like counselling services, or somebody that's in the room with artist practitioners or researchers. I feel that's quite important, and that would be an important thing to mention. We've talked about the therapeutic benefits of art, but obviously we are not therapists, and I think we have to make that very clear on facilitation as well, that we are there to facilitate. And then I hope that's answered some of your questions. I suppose in a sense I haven't had to go through an ethics board, but I have had to have those conversations with NHS England at the start. And also I worked alongside CHSS at University of Kent. So we had that kind of like partnership. It's very difficult again for creative researchers and from the grounds workers to partner, and I would encourage highly that changes within the system, because I think those partnerships are really important to ensure ethics along the way. And with response to your other question very quickly, co-production is the key. Having somebody work with you from start to finish, it depends on why you're implementing creative research methods. And I think if you have a community you're working with who prefer those methodologies, then they'll be able to tell you what kind of methodologies they would like to work from. And it's about having a scaffolding, not necessarily having a 100% sure possibility of the exact methodologies that you're going to use, because that will change throughout the project. But I would say, yeah, at this point, even putting in your application, there needs to be a public advisor, there needs to be someone with lived experience who guides you through that process, because we have to remember it's not a lesser way of communicating, it's actually very nuanced and reflective, analytical, multi-layered. You will find people who are able to work as a can't think of the word, but to co-produce your proposal as well, which I've also done on a couple of projects as a public advisor, and I think that's the best way forward, but that's just my opinion. Thank you.
Thanks, Sarah. I was going to say questions for Raza and Sarah and Nikki and Azimma, but you got your hand up, Sarah, so go for it.
Oh, it was just to come in on Kat's question. And to be honest, I mean, I'm happy to have advice from other people on this as well. So the one thing that I've found difficult, and sometimes I've achieved it, but sometimes I haven't, is when you're at that very, very early stage of developing something, when there are so many question marks around what it's going to look like when it's ready. Depending on who you're working with in a PPI context, like that uncertainty can be very daunting for people as well. So I've worked in situations where, like Sarah was saying, I've had a scaffolding in place where I've kind of had ideas, but we've been able to work around it. I've also worked with a blank slate before with people, but they were individuals who were PPI professionals, if you know what I mean. They'd had a lot of experience beforehand, so they were comfortable with that. But I think it's an interesting question, because I think that's actually a very complicated place where you've got a lot of uncertainty. They're probably coming in new and have a lot of uncertainty. So I agree with Sarah. I think scaffolding is the best way forward. But then sometimes I worry that that's driving things in certain directions as well. So maybe if there are ways of breaking the scaffolding and saying, well, these are ideas, but, you know, go beyond it if you want, you know, if there's anything that flares up or comes up. But yeah, I don't know if that helped, but that's just, yeah, various experiences.
Nikki, go ahead.
I think one of the main things at that stage is to be really fair with people and to manage people's expectations as well, because people can come up with so many ideas and all of them are probably worth pursuing. Some of them may have been already highly researched and might be less in need of more attention, but they are people's concerns. And if you're asking quite openly for people to bring their concerns, then ethically you are under obligation to explore the various things that people bring. So I think a degree of kind of framing so that people understand whether their particular issue is going to be taken forward or not is really important in those really early stages. But I would also think that, you know, when you have a group that you develop over time and work with regularly, like many institutions do, you know, we have a lived experience group that's linked to our Centre for Dementia Research, and we work with people over years, not months or weeks. So you do, you know, you develop relationships which are really core to making good work together, and then you have an opportunity to have moments where you come together, like Lou mentioned, our group comes together annually for an in-person session, and that's where we might explore their research priorities or their current interests, and we can do that in an open way where we're not specifically kind of tackling a grant application or thinking about a specific funder at that point.
Reza?
Circling back to the question of funding, which is a challenge, and different funders can deal with this. We'll figure it out when we get there, and that's the right thing to do with better than others. But even the healthcare funders, in my view, are starting to wrap their brain around co-production. So the only time I've slipped something creative through to something that's funded so far is I couched it in the language of co-production, and that was okay. The only other, but that is to some degree deciding the methodology, but as you said, the scaffolding is there. The only other time when I've been able to get funding where you build the scaffolding with a smaller PPI group too and decide what the approach will be, that was a career development award, so kind of different goalposts applied. So maybe sometimes the answer is staggering too, of talk about co-developing a method, then go forth. But the struggle is real. You know, none of this solves the fact that we may have approaches, values, etc. at play, but funding doesn't necessarily allow us to fully practice them, or funding constraints rather.
Yeah. I mean, that's with everything now, really, isn't it? So any more questions? And no, one more chat. Any more questions? Or if not, no one's got a hand up, I'm going to draw things to a close and give you 5 minutes to go and sit in the sunshine.